16 or so days at least. Today we've got Karen Lynch, Karen Whitney, and Hope Merz back with us. We've got our team back, and we thought we were talking about kind of an interesting but yet common problem that we see, and that happens to do with the earlobes. So there's all sorts of problems or concerns that ladies typically have with their earlobes, but we also do see men, and we'll show some photos in a few minutes here. But what I'd like to do, we kind of used this format last time where we challenged our team a little bit. So we're going to try to show some photos here, and in doing so, let's see if we can handle this here today. Can you guys see that screen okay?
Yes.
Yeah.
Okay. So what we're looking at here on the left, and these I will say are not our photos. I did the same thing. I scoured the internet a little bit. We see many, many patients, but for efficiency's sake, while our team's not here to retrieve everything and help me out a little bit, we did find these from the internet. So these are not our photos, but these are very common sorts of problems that we see. And so Karen Whitney, let's start with you a little bit here. So a patient comes in, and on the left here, tell me some of the things that you might consider doing.
Well, what I'm seeing is that the earlobe has lost its nice plumpness, its shape, its cushioning. It looks deflated, which makes it look older. And one, if that patient wants to wear an earring, it's not going to sit as nicely on the ear. But also, if someone looks at that earlobe, it just doesn't look as nice. So we use injectable fillers, surprisingly enough, to plump, restore volume, and give the earlobe that cushioning, plushness that it used to have. And we can use really one of several of the hyaluronic acid fillers in this earlobe. And sometimes this is the main reason someone comes in, but sometimes we've done a little bit of facial filler, and they might say, oh, you've got a little bit left, can you put it in my earlobe? And so what they're noticing is that the earlobe hangs a little bit lower. It's not holding an earring as well. It just looks a little bit shriveled.
Okay, so you might use, so when you talk about using fillers, what specifically might you use?
Really, I would be comfortable using pretty much any of the fillers. If someone came to me with this and that was their chief complaint, I'd probably choose Juvederm Ultra Plus, only because it should give us a nice year's duration or more. In the earlobe, I would expect it to last longer because there's simply no activity on the filler. It's not being moved by facial muscles. It's probably not being manipulated a lot. And the technique would be either a lifting sort of bubble or a threading, kind of a fanning motion, or a combination of both. So it should, I would expect earlobe filler to last significantly more than 1 year, just because it's a low blood flow area, it's a low manipulation area, there's not a lot of activity happening, so it should be a very nice treatment. If a patient said, hey, I just want to do this once, never again, I'd be comfortable using Voluma, which is our longest lasting filler. And it should give the patient more duration than the Juvederm Ultra or Ultra Plus would.
Okay. Any problems any problems with their ears being pierced if there's filler in there?
No, that piercing channel is going to stay intact. The filler will plump around it, and the patient can immediately put their earring back in.
Okay, great. Okay, so let's go to the next one here. And Hope, I guess if you want to come back, I mean, both of you can stand. You both can take a stab at these here. So two different problems. The problem here on the right is something that we commonly see is that the ear piercing begins to get stretched a little bit, and yeah, you know, you probably can't wear studs. It'll probably fall through this thing, and obviously it may tear. When it tears, it may look something like this, where the entire earlobe is split. So what do we do for this?
Hope, I'm going to turn this over to you and preface it with the fact that my 89-year-old mother had one torn earlobe like what you're seeing on the left, and it really bothered her. It looked funny. And so Hope repaired it very successfully and did a beautiful job, and my mom's very happy. So I'm going to let Hope talk about this one.
I mean, earlobes are a big deal. So we all wear earrings. A lot of women do. Some people don't, but a lot of women do. And if you do, it's important. If you don't have them in, it kind of feels like you're almost, I say, oh my gosh, I forgot my earrings. I feel like I'm naked today. It's just kind of becomes a part of us. So when you get these torn earlobes or your earrings start to create, it's like the hole starts traveling downwards and you can't wear your heavy earrings anymore, and you avoid wearing certain jewelry because of the appearance of your earlobes. It becomes a concern. And so we do like to take those concerns very seriously and repair them. And one of those photos you saw where it wasn't torn all the way, we may be able to get a little bit of improvement with filler, but the best and most long-term option for that is most likely surgical. So we do something called a lobuloplasty. And what that involves is you come in, we clean the area thoroughly, we look, we mark it, and we kind of mark what looks like a little pizza slice, like a narrow little triangle, a little wedge around where that torn earlobe is, or around where that hole is. And we'll make a little marking, and then we take some numbing, so a little tiny poke. It doesn't, I mean, it's one quick little tiny poke. It doesn't hurt. It's actually probably not as bad as getting your ears pierced initially, but that takes effect right away. So the numbing works like that. There is some epinephrine in that mixture that we're injecting, and that is what constricts the blood vessels. So the blood vessels, when they're constricted, they're not going to bleed as much, and so we can have a pretty near to virtually bloodless procedure. And what we do is we expose some of the underlying skin. So obviously you can't close that wedge just like this. Skin on top of skin isn't going to allow itself to heal together. What you want to do is just take off that little bit of the top layer of the skin so that you have some exposed underneath the dermis, the underlying skin, and we can put that together. And then we just put a few sutures down that line. And you leave with sutures for about 10 days, and then we take those out. We allow that incision line to heal, that area to heal for a while, and then we can re-pierce and put your earrings back in about 6 weeks. So it's fairly simple. As Karen said, her mom had one side that was like that, and you know, you don't really want to wear one earring, and this was really bothering her. So after that, she was so happy afterwards, just that look on her face where, oh, it's gonna look normal again. It's great. So very easy option to repair those earlobes.
Yeah, I remember Karen's mom. She had a smile on her face the entire procedure. I think she was so excited to get that earlobe repaired and the earring restored. But so Hope, you can't just. I've got patients coming in. Oh, we have patients coming in who they try to like tape or glue their ears together. How come they can't just do that?
You mean the edges?
Yeah.
So epidermis to epidermis, the skin layers here. It's like if you put your hands together. Okay, they're not gonna just fuse together. You need an open area for that incision line to properly heal close and all of the good stuff inside of our skin to connect together and heal into one piece. So that's why we take those wedges and we create a little incision line to expose the underneath skin on each side. So when we put that wedge, that pizza slice together, those inside fibers are going to connect and start to heal together.
And then when, so the sutures stay in for how long after that?
About 10 days.
Okay, and then when did you say the ear could be re-pierced, the earlobe?
I typically do about 6 weeks. So give that time to fully heal. We don't want inflammation in there so that your ear piercing will heal effectively. So about 6 weeks, maybe a little less.
Okay, and then you want to bring a big like hoop in to re-pierce it with, is that the idea?
We want just a little stud. So if you can remember back to when you initially had your ears pierced, you want a little stud that you can rotate and keep it clean, and that's going to stay in for a few weeks, and then you can switch to your other earrings. But no, initially, I prefer solid gold or something without any nickel when we re-pierce it so that we reduce the risk of having an allergic response.
Okay, yeah. I can't, I was amazed. you know, the procedure isn't terribly difficult. It's kind of fun, but what's crazier is that patients, mostly women, are pretty excited to have that earring. It's like you're whole again, you know, 6 weeks later when you get that repair. So that's a very common problem that we see. Let's see if I can get back to the next one here. You guys can see that slide okay? All right. So tell me about this. What, you know, this is a common thing that you see. I don't know, I see it maybe less commonly now than I did maybe over the last 5-10 years, but these gauges in the ears, and then for whatever reason, people decide that maybe it's time not to wear the gauge and they want the earlobe repaired, and this is what you're dealing with. So tell me how we would handle something like this.
So this is going to be a similar fashion to what we just talked about. You can see that her earlobe has stretched throughout the years from the use of those gauge earrings. Typically people start with, you know, little smaller circular earrings and they work their way up to achieve that kind of a look. But years down the road, sometimes that may bother people and they want their old earlobes back. And so what we have to do is a similar fashion to what I was discussing before. So you see that she has all of that healed skin within that circular hole. We need to open that back up so that it can heal together, and we'll shape it into the shape of a normal earlobe. We'll have to remove some of that redundant skin on the lower portion and then expose just with, you know, the normal injectable little tiny quick poke. Your earlobe is numb. And then we create an edge that can heal back together. So we'll have to take off that first little layer of skin with an incision, and then we can form it back into a little cute earlobe, and then we'll re-pierce it later.
Okay, so very similar, just, that's right, I forgot you could see the screen. So what Hope's talking about is this area here. We'll want to remove it. Many times what happens is you've actually got to remove, you can see where this mouse is down here and down here, you're actually removing all this stretched earlobe. So you can imagine what you just said, you're cleaning up the area around the circle, and then you're suturing it together to reestablish a normal earlobe. Okay, so let's move on to this, and let me just make a few comments. We talked on a prior show about hypertrophic scars versus keloids. And so this is what we would call a keloid. You commonly see keloids in African American men and women. That's kind of the classic sort of situation. Other ethnicities can also form keloids, of course, but this is a very typical sort of thing. And so, Hope, how do you attack this one?
So keloids are more complicated. So a keloid is going to be something that it's a scar that forms beyond the initial wound. So this was probably just from an ear piercing, and then over the years, since that patient had a predisposition to have keloid formation, that scar grew and grew and grew and grew. And so the best approach is to actually remove that scar, that keloid, and then follow that very closely, because those patients are going to have a risk of reforming a keloid. So what we want to do is make sure that we see them back every, few weeks. And if there's any sign of any keloid formation or hypertrophic thickened scar, we're going to want to use a medication called Keloids, or there's something called fluorouracil, and we can inject that where the hypertrophic or thickened scar appears to be forming. We actually end up doing that quite frequently, because sometimes these people do end up getting those keloids that want to form a keloid again. And it's very successful to follow that incision line and keep that keloid from forming. And that's really important. So what we don't want is someone to get a keloid removed and, okay, see ya, it looks great, we'll see you again in a year. We're not going to do that. So we're going to make sure that you come back and we focus on that incision line for months, maybe years to come, and make sure that that keloid does not form again.
Yeah, I think that's one of the most difficult parts of it is to perform that surgery. I mean, you've seen it. You take care of that keloid. I mean, you've just completely changed somebody's life. And early on, it looks great. I don't know what the percentage is for these things to return, but generally they return to some degree. So, so we sort of read you the riot act in terms of coming back, making sure that we don't lose you to follow up. Because if we see you a year and a half later after your keloids returned, then we're kind of back to square one, and we've got to go through that surgical procedure again. Otherwise, as Hope's saying, with 5-FU and with Keloid, with some steroid injections, we can keep it calmed down, and hopefully it won't return. Okay, so this next one here, let's see. I'm going to come down to this, and this is something that we can see following surgery. And I know we haven't done a thorough facelifting talk yet, but one of the things where these incisions are made around the ear lobules, and we'll talk later about making sure that we're tightening that smaz properly, but bottom line is this earlobe can get pulled down sometimes. So we want to do some things surgically to avoid that complication. Needless to say, this is what we call a pixie ear deformity. And unfortunately, we still see this. We don't see it commonly, but of the complications or issues that we have, an earlobe being malpositioned or pulled down in this case is something that we can see. So, so when we see this, we'll continue to see. We see you back at around 1 to 2 months. Well, we'll see you back the next day. We'll get your sutures out about 1 to 2 months later. Around that 4-month follow-up appointment, if you're going to start forming this, that's typically where we'll start to see it. And like Hope was just talking about with the hypertrophic or keloid scars, we can see hypertrophic scars sometimes. Sometimes we can see thickened scars around the ear lobules. So in that instance, injecting with Keloid is something that is very effective. And so often we don't need to do anything other than inject it. On occasion, however, the earlobe is pulled down. It doesn't look right. It's one of those telltale signs of surgery. And so we perform a little procedure called the Lobulplasty. It's a different sort of Lobulplasty where we're incising. We're making an incision just right around where the incision is and repositioning that. So this is a pretty common situation that you'll see, particularly with facelifting procedures that aren't addressing the underlying tissues, or what we call the smaz, real well. When there's a lot of tension on that area, you can imagine if you're turning your head, that earlobe might get pulled down. So we want to be careful with that sort of thing. So those are some things that that are related to earlobes. You guys, Karen, Hope, do you have any, or Karen, do you have any other thoughts about earlobes?
One thing I can share is that I had an email from a prospective patient this week, a young man who's interested in joining the Army, and he has gauges that he's had for quite a few years. And so that, work, employment, especially joining the military, would be one of the reasons that we see patients coming in to correct that that lifestyle choice of getting that gauge placed.
Yeah, that's right. What is the rule? I think the rule is they can't be able to shine light through any part of it. So so often they want to enlist as soon as possible, right? And so we do see a lot of men and women, but we see mostly men, I think, in that category. Hope or Karen, any other thoughts with earlobes?
I think a lot of people don't know how easy it is to do these treatment options. And when Karen was talking about the filler, you don't really think about putting filler in your earlobe, but I mean, even just like she said, when she's doing filler on some other area of the face, you put just one little bit and it just perks it right up, and you can see your earrings better and they're more supported. It's pretty cool what these procedures can do. So I think it's definitely something that everyone should take into consideration, and go look at your earlobe today and see if you can do a little something.
Good suggestion. Karen Lynch, any concluding thoughts here?
Now, I just know with the gauges, I mean, they really bother me personally. Like, I have a hard time looking at them, but the patients that have come in say that there's an odor to them. I don't think we brought that up, but I think it might even be more than just, getting rid of the look. But sometimes I think they talk about an odor, and I don't know why, but.
Oh, that's interesting. Huh. Well, okay. Well, thank you guys very much for your insights on earlobes, and we'll post more, and maybe we'll post some surgical videos along the way as well on this topic. But anyway, well, have a wonderful day. We will see you back tomorrow at noon, and hope you have a good one. Thank you very much for joining us.
Thanks, everybody.
Bye.